So let's talk about the differences between awake anesthesia under local and general anesthesia. Awake anesthesia is performed with the patient still awake, under a sedated state with pain management and anxiety management, and then we work with local anesthesia to numb the areas that we're going to treat. It is a very limiting procedure, I would say, and we do need to keep it limited to what regions we're treating, the amount of work that we're going to be doing, and making sure that we can actually get the impact that we need. I'd say that awake anesthesia has been very popular in some med-spas, and I see quite a few patients come to me with severely underdone liposuction, for example, because it was too painful, they couldn't tolerate it, and they end up leaving with almost nothing done. Awake anesthesia is good if there's a small area of surgery in a patient who doesn't have a lot of anxiety, who understands how it's going to go, and doesn't require a lot of local anesthesia, because there is a limit to the amount of anesthesia that we can provide. General anesthesia, on the other hand, I would say is much more commonly performed and is extremely safe. I really can't say that enough. Patients come to see me to talk about surgery, but I would say I feel it's in my responsibility, and I'm sure my board-certified plastic surgery colleagues all feel the same, that we are responsible to vet our team and make sure that we have a very safe anesthesia provider in an accredited facility, and that everything will be performed according to the highest standard of care. The beauty of general anesthesia is we can perform almost any level of a surgical procedure in an extremely comfortable way and do what we need to do to get the final result that we need to get, not being encumbered by anxiety or discomfort or dosing of anesthetic that we are limited. As you get closer to surgery, what kind of anesthetic are they going to do? That's definitely a question that should be addressed, even if not in the initial consultation. You should circle back and definitely address that with your surgeon, because the last thing we want is for someone to enter operative procedure with questions that can cause anxiety.